judge in the accountability court. And she and I have been on this journey, and it's been a wonderful experience for both of us to be able to work on such an important topic. And I especially want to thank the media, because I know it's a holiday weekend and that you took extra time, and I know you want to get out of here before traffic's bad, and so do we, and we're going to get out of here. That's all anybody thinks about in Atlanta. First of all, I want to say thank you to all the mothers that have come today, and you can look around the room and see all the photographs of their children, and it's not just mothers. We have fathers here, we have boyfriends, we have girlfriends, we have people who have lost their loved one. And I am a state senator from Gwinnett County, but I've lost a loved one too. I lost my son, and that's why this issue resonates. I know what the grief process is like, but I also know that despite everything you go through in that deep grief process, that the most important thing you can do is to turn that grief into something better. And that's exactly what I've done in my son's memory, and that's exactly what folks here are doing. The purpose of the news conference today is to put a face with an epidemic. We are in the throes, literally. We knew the door was knocking. We knew that substance abuse and the opioid epidemic was going to migrate from the northern states and from Vermont, Maine, Kentucky, Ohio. And we knew that eventually that it would be here. And sure enough, it's here. It's not as strong as some other states. I understand that Florida, which is a double population of the state of Georgia, but I understand that it's finally here in the South. And our goal with Judge Schrader, and if you look at the agenda and the run of show today, you see that you have the legislative branch, you have the judicial branch, you have law enforcement, you have the medical community, and you have the federal government, the state government, and the local governments here. So this is an issue that knows no cultural bounds, it knows no ethnicity, it knows no socioeconomic status. It affects everyone. So that's why when I said it's the face of the epidemic, I wanted to make sure that we touched into each one of these particular groups of people. I want to say a special thanks to the federal U.S. Attorney General John Horn, who is our representative here in Atlanta for the Southeast region. He is not here today, but he has sent the other Assistant Attorney General. Jennifer Whitfield is here today. Where's Jennifer? Right here. We want to say thank you to them. We want to say thank you to them for running the Heroin and Substance Abuse Task Force. Y'all are doing a great job. We appreciate the camaraderie and the sharing of information and the infrastructure development around this issue that you're working with us. We also have Ms. Nellie Miles here, who is going to speak, but we also have the Deputy Director of the GBI, Bain Rich, is here today, and we want to say thank you. I know some of the state departments, I know that Public Health and some of the DVHDD, some of the other folks are here today. We want to say thank you. Thank you for the work that you're doing, and thank you for continuing to work on this important issue for all of us. We have the grassroots here in this room. You are the grassroots, and that is exactly what Judge Schrader and I have been working on, is consolidating people who are interested in this topic and getting that grassroots together. I have to say a special thank you to Commissioner Brenda Fitzgerald, who is working on the planning stages in the Department of Public Health and working on facing the epidemic and planning. And there's some folks that are here that are also doing that. I want to say thank you to them. The most important thing, as we know, is education. That's what we're doing here today on a holiday weekend. Prevention, and most importantly, therapeutic services. And that is exactly what drew Judge Schrader and I together. The most important thing that I do is not write laws. Everyone thinks it is that I write laws, but the most important thing I do is appropriate money. And that is what I am getting ready for in the 2018 session, is to be able to appropriate more money so that we will have the ability and the better abilities to be able to fight this epidemic, so that the pictures you see in the room there won't be more pictures. And that is our end game, and that is our goal. So with that, I'm going to turn it over to Judge Schrader. The press and the media, the most important thing you're going to hear is not the elected officials, but it's going to be these mothers that are standing right here. I ask you, please have compassion. Some of them have just lost their children just a few weeks ago. They've never spoken in public before. So I appreciate y'all listening to them, and I admire their courage. It's just phenomenal that they have the ability to be able to come here. Judge Schrader.
All right, good morning, everyone. How are you? I know it's hot. I'm going to be brief. I have a few topics I really want to touch on. First, I echo Senator Unterman's statements about honoring those today that have lost their battle. We honor you. Today's purpose is to take your pain so you can help us with our purpose, to now reach those that are struggling, those that are still in the battle. I come to you as a drug court in Gwinnett County. Georgia has many drug courts. One of the reasons that I wanted to be involved in this is because on May 25th, we had a summit in my community. It was standing room only. Many of you were there. On May 26th, I found out that 2 boys in my community had lost their battle as a result of the toxic poison on the street. And if that wasn't bad enough, I found out that one of those boys had been in my system and had been let out on probation to get ready to go to treatment. Why is that so bothersome for me? Is because my community desperately needs a transition center, a recovery center, a therapeutic center, so that we don't allow people who have gotten so wrapped up in substance abuse disorder get in the system and then be released before they can find appropriate care. I believe that now it's our duty and our burden to make sure that we have brick and mortar appropriate care in every community in this state and every community in this country. I wore my red, white, blue today to honor not only the nation's Independence Day, but to ignite and encourage everyone that can hear my voice. Get involved so that we can declare victory over this battle, so that we don't have to worry about whether our kids are waking up dead because they have gotten hold of some type of toxic poison on the street. Everyone is touched by this crisis. Every system is being impacted by this crisis. There are no easy answers. There's not a magic bullet. Substance abuse disorder, mental health issues thrive in isolation, and they thrive on instant gratification. That's exactly opposite of what we need to fight this battle. It's going to be a long-term, patient, intentional battle. It's going to take us all to persevere. I want all of you in the sound of my voice to reach out to every leader that manages your community on the community level, state level, federal level. Have a voice in this battle. I honor all the parents, the loved ones, the support system that's here. Y'all know that for every single person that struggles with this, at least one, but usually 5 or 6 are impacted by this disease. In my court, we could service so many additional people who are struggling if we had brick and mortar resources in Gwinnett County. And I echo that for many of my accountability court judges across the state of Georgia. But we don't have that. We need that. Brick and mortar. We really don't need more meetings to figure that out. We really don't need more meetings to figure out we have a problem. We really don't need any more meetings where parents come and they hear the same tragic data. They hear the same tragic protocol. So my purpose of being here today is to issue a call to action. Action, contacting your leaders in your community And those include your chamber your chamber leaders, your business leaders, your church leaders. We need every system activated in every community across this country. Build awareness in your neighborhoods. Alert neighbors that may be oblivious to this because they think they haven't been impacted. But yet, their kid has probably lost their best friend. And guess what they're going to end up doing to satisfy that trauma? We need to wake up to what's happening in our community. Also, contact your medical professions. Anytime you're at a doctor, please take an opportunity to educate them about the overprescribing. Thank you, Senator Unterman. Where did you go? And my Georgia legislators for coming up with a protocol to manage who's getting what, because that's been long overdue. Georgia needs to lead the nation in conquering all the systems that have participated in creating this crisis. If you have anyone who works for a pharmaceutical company, make sure they're aware of what's happening. I personally have taken my children to different doctors over the last 12 months where this crisis has been on the forefront. For sports injury, for sore throat, for the sports injury in particular, and wisdom teeth removal, both of those physicians tried to give my children 30 Oxycontin. They're young adults. So I took the opportunity to give them some material, share with them some websites and links. So everybody can do that. We can start spreading the education. I want to challenge all of you to write a letter to at least 10 people. If everybody in the sound of my voice contacts 10 people, your voice will be heard in a magnitude like never before. Also, encourage your local leaders to do a needs assessment to find out what brick and mortar resources we need. Because if a needs assessment is done, then they will have the evidence and the data to realize. In my community, I have to use the jail and the work release program to keep some of my drug court participants safe, sober, and alive. That is not using best practices. That is not a holistic environment for somebody that's supposed to be in recovery and building a better life. But it's the best I got. And I'm using the best I got. But I'm here begging for better. We're all here begging for better. Also, if you have an idea for some sort of legislation, as you can see with Senator Unterman, don't buy the lie that your representatives don't care. They care. Reach out to them. Give them the information. Give them the ideas. They all want to help. They all want to help. We have a strategy. We have a coalition. It's getting bigger and bigger. I honor all of you today for taking time out of your Friday morning to come down here, support the cause, be involved in the cause, move the cause. My message to you is, let's keep fighting. Let's keep fighting. Our purpose is greater than the pain. So thank you all for being here today.
Ms. Nellie Miles, she's Director of Office of Public Affairs with the GBI.
Thank you. Good morning, everyone. On behalf of the GBI Director, Vernon Keenan, we appreciate the opportunity to share some information. As far as the GBI is concerned, everyone is aware that we are a law enforcement agency and we enforce the drug laws. But one of the things that's very unique about our agency is we have the GBI Crime Lab. And at the GBI Crime Lab, we realize that there's a lot of information there that it's important to share. Although I'm a public affairs person, I'm a spokesperson for this agency, I was a forensic chemist for 16 years. And for all of that time, I mean, the worst thing that I had to worry about is a cocaine case, a large kilo of cocaine. I never feared testing a case. I never was concerned. If I wore my basic, proper protective equipment, I knew I would be okay. But that is not the case anymore. And I think that it's important to understand that although the information is out there, we hold the the information as far as the repository for the state. And what we realized a couple years ago, as we knew, as Senator Unterman has already stated, that this was coming to our state, was that we started seeing a lot of abuse of prescription pills. Our oxycodone, methadone numbers, hydrocodone, they started to rise. And then over a period of time, we brought attention to that. We noticed heroin was on the comeback. And so we started looking and said, this is interesting, this is an interesting trend. And again, we chart those trends because we don't want to keep the information to ourselves. We want people to know. Even if a law enforcement officer is on the street, nowadays they have no idea what they're buying that's coming into the crime lab. And then one day, we noticed that the heroin was getting cut with fentanyl. And we're talking about a white powder, just to let everybody know this is flour, this is not real. And I want to be clear about that. We noticed that something that looked like this, white powder, very fine material, was being cut with heroin. And we started asking the questions why, and we realized, well, it's cheaper, it's all about the economics, but we couldn't figure out that why something that's supposed to be administered in small doses in a patch under hospital care would be cut with a street drug like heroin. It was scary. And then not to mention, fentanyl is a drug that's transdermal and can be absorbed through the skin, it can be inhaled, and again, at that particular point, we started saying, well, we need to start to take a step back. And so we dealt with that. And so we saw heroin and fentanyl. And again, we're about data, we're about sharing numbers. Here recently, we realized that those individuals that are profiting from putting these poisons on the streets started to change the formula a little bit. And we saw this with designer drugs. That's the whole purpose. They're making these drugs to get around existing drug laws. And we're thankful because we have a legislature and a governor that is very supportive of working with us as we start seeing these new substances. But years ago with synthetic marijuana, we all know K2 spice, but the difference between synthetic marijuana and these synthetic opioids, we did not see the bodies coming into the morgue like we are today. And so that's why it's important for us to be a partner in this, because we have the information. And during the legislative session, we noticed that carfentanil, which is an elephant tranquilizer, was showing up in the drugs. Carfentanil, marketed to those individuals that were suffering from this disease, heroin. And I'm going to show you, I also brought with me, if you will just indulge, and we've shared this, but again, it bears repeating. This is the amount of heroin that it takes to overdose. You can see that. And then we go to fentanyl. You can barely see the amount, how little it takes. And then now we have carfentanil. You probably can't even see that. But this just goes to show you how little it takes. And so, again, this was a very troubling trend. And we've been partnering also with our media outlets out there to share this information because, again, I'm not saying that we wouldn't know, but the fact that we're seeing we get all of these cases, working thousands upon thousands of cases coming into the GBI crime lab, we said, again, it is important to let the information out. And so recently what we're seeing is that they're making new fentanyl analogs, and these are just essentially very much like fentanyl. But the problem with it, if you take a drug like fentanyl or carfentanil, we know there is some legitimate medical use for them, okay? We understand that we have a doctor that can hear that can talk about that. But a drug like fentanyl that we're seeing, the newest one that was reported, fentanyl, tetrahydrofuran fentanyl, what is their purpose? Nothing but poison on the streets. And it's just not right. So for us, this is very important to us, and we, again, appreciate the opportunity to share that information as far as what is important that we tell as far as, what to be kind of concerned about and what we need to understand. Our message is not that you should fear leaving the house. That's not what we're saying. We're saying that if you come in contact with anything that is some sort of unknown white powder, and even, you've seen the stories about the counterfeit pills, we discovered that internally because I received a message from the chemistry section that said we have a pill that's being marked as oxycodone, but the results came back containing heroin, fentanyl, and fentanyl in one pill. And I made a request. I said, could you please go back? This is very troubling. I know counterfeit pills, we've tested it, it's been around, but typically, if you're getting a fake oxycodone, the results are going to come back oxycodone. It's just that, they're pressing these particular drugs just so that they can make the money. But what we're seeing is that we're seeing all different types of synthetic opioids being pressed into these counterfeit pills. And then there was the massive alert to the public so that people would understand if you think you're popping a pill that is oxycodone, guess what? It is not what you think it is. And so we put that information out there as well. And so, again, the point to all of this is that we would like to be able to continue to share that information and let everybody know that's what's out there in terms of protocols for safety. If you're a law enforcement officer, we've been telling law enforcement officers that are out there, definitely wear your particle mask. A particle mask is 95% of the particles out. We suggest nitrile gloves. We suggest minimal skin exposure. If you're a person that is in a situation where you encounter this, we say do not approach, do not touch. You contact someone, either a fire department, local law enforcement that can get out there, because we treat this as a hazmat situation. And I'm a person that goes out there and I will see what the public is saying and I'll see the responses, and there's still plenty of people that don't understand that this is that serious and think that it's over dramatized. But we have the death reports to prove it, and we have the family members out here that can really, really say this is a serious problem. And again, on behalf of the GBI, we appreciate the opportunity to share this information. Thank you.
Next on the agenda, we have 3 different mothers who are here to put that face with the epidemic. And first of all, I have Robin Cardiches, who most of the media already knows. You saw her at the Capitol many, many times, and she's the first of the lobbyist mothers that came to the Capitol. And fortunately for us, she is leading the other mothers now and leading the charge. Robin?
Could you spell your last name, please?
Cardiges.
Thank you.
Robin like the bird. This is my son, my beautiful son, Stephen Cardiges, who we got a knock on the door late a Sunday night. Was the captain of the Snellville Police Department telling us that our son was DOE at Eastside Medical Center. He passed on August the 12th, 2012. He was with a group of other individuals who were afraid to call 911. When they finally got a first responder there, they did not have the antidote naloxone. And many people in my community reached out to me and told me similar stories that no one was talking about. I thought he was an outlier, but I realized it was an epidemic. So I reached out to Senator Renee Unterman. I thought we need a law. And I met up with another individual, I don't think she's in the room right now, Robin Elliott, who also lost her son, who had reached out to Representative Sharon Cooper. And we teamed up with a lot of other courageous parents who were willing to tell the story, and we were the lobby moms. We told the story in the elevators, we stood at the door, we told anybody that we could talk to about this story. And we needed a law passed. So on April the 14th, 2004, Governor Nathan Deal signed the 911 Medical Amnesty Naloxone Access Law. He inked it, so it was done. It wasn't just passed, 2014, excuse me. And so, briefly, this law protects you if you're around someone who's experiencing an overdose of any kind, including alcohol. You're free to call 911. You're immune from prosecution if you stay with them. You're immune from prosecution for administering, and actually late last year, Governor Nathan Deal made naloxone access available to everyone in the state without a prescription. That's the brief synopsis of it. And we were so happy on April 24th of 2014 that we got this law passed, because it was a lot of effort telling this painful story again and again and again. And then within days of that, we learned of a fatal opioid overdose. And we got together and we realized that we've got a lot more work to do. So we formed Georgia Overdose Prevention, and we partnered with the Atlanta Harm Reduction Coalition, and we talk to anybody who wants to hear us. We educate them about the law. We talk to universities, to church groups, to civic leaders, to students. Now we're moving down in the age group. But so far, as of last month, we've distributed over 3,500 kits. Anyone who wants a naloxone kit can contact us at Georgia Overdose Prevention, and there's folks all over the state who will meet you and train you and equip you. We've had reported 649 reversals. And I want you to know that that's not always reported. For us, when we give a kit, we ask that they let us know when they used it so that we can make sure that they have additional naloxone and also that we can keep up with the numbers. And I know this number is very underreported, but as of last month, it was 495 reversals with our kids. And law enforcement is now carrying, many law enforcement organizations are now carrying, and the number last month was 154 reversals. So shout from the rooftops, tell everyone, don't call, don't run, call 911. Thank you.
Both of y'all come up here.
Good morning, my name is Kathy Abraham. This is my son Joseph, and 5 weeks ago this morning, we found him at home after an overdose. We believe was from probably this much something, was in some heroin. So needless to say, it's been a very difficult 5 weeks. Within those 5 weeks, we are trying to educate people as much as we can through our grief. On May 25th, I was actually at the summit with Judge Schrader and Senator Unterman, trying to educate myself as a parent about the dangers of addiction and drug use. It was that night that I learned about fentanyl. Actually, I wasn't aware of it as a parent who'd been struggling with my 19-year-old son for 4 years prior to this. So I had no idea that the next morning that my son, along with Dustin, we live in the same neighborhood, that we would find our boys victims of this poison. We know from that moment on, we live in a nice community. You know, I'm a public school educator, and I think what happened was the outpouring of love and response we've had has been, I can't even begin to describe. I believe that people now see that addiction does not discriminate, you know, and I know how difficult it was for me as a public educator to try to keep this kind of to myself, and I would only confide in a few people and go to my NAR-NON meetings and those sort of things, and my Navigate Recovery meetings and those sort of things. But when this happened, it was like the whole world opened up to me. You know, I want to tell everybody about it, and especially educating parents. You know, my husband and I, we didn't know what to do. We didn't know where to go. We didn't know insurance wouldn't cover his rehabs. You know, we're middle-class people. We don't have the finances to take care of those things. He was scholarshiped into a rehab, but he was released on Mother's Day from Gwinnett County jail system, and within 2 weeks he was dead. So basically my goal, my vision is to honor my son from here on out. He has a name. He's not just a statistic. He needed help. And I think that now my vision, and ours, Lisa, as well, is to begin to educate our kids at an earlier age. You know, I know Joseph probably, from what I can gather, probably started, he got his wisdom teeth out, as Judge Schrader mentioned, and he seemed to like the effect of the medication on the pain that he had from the wisdom teeth. But I think that our goal is to start reaching our students and our kids at a younger age, even in 4th grade, 5th grade, give them kind of an overview, and then really hit home in middle school. And I don't know that our school systems are doing that. I don't know that we're covering it like we need to. And speaking to other students and other parents, I'm not sure that we're getting that message out. I know as a parent that I was not aware of this at all, even though my son was dealing with addiction and was, you know, getting some help. But, and anyway, I think the education piece is really important. So with that, I'll let Lisa step forward.
My name is Lisa Manning, and that's my son Dustin. Sorry. To piggyback off of Kathy, 5 weeks ago this morning, same thing. My husband walked in and was getting Dustin up to go to work, and he was already dead. He'd been in rehab. In fact, I worked for the rehab place that he was in, and I work with these addicts day in and day out. Look at these guys. They don't look like your typical stigma addicts. None of these ladies and gentlemen that these people are holding in their pictures are loved ones. None of those people look like your stigma of an addict. That's where we need to change. We need to change the fact that they are not your homeless, your low income, your low life, uneducated people. These boys were outstanding citizens. They had an amazing group of support system. I homeschooled my kids up until they were all in high school. So, and I did that because I was worried about the bullying incidents, not the drugs. I had no clue about drugs. I thought I was hip. I thought I knew all about Twitter and Facebook and social media. I wasn't, obviously. I don't blame myself for any of this. This was not any of our blames. I hope you parents understand that. That is not your fault that your loved one is gone. I think that's important to realize that it's an addiction and it's a disease. And people will argue and say but it's not their choice. I disagree. I work in an addiction recovery center. It is not their choice. It's whatever triggers in the brain. It's a chemical makeup. You can take a drink or a drug and say, I don't want to do it anymore. They can't. It's their livelihood. It's how they survive. And they can't turn it off. That's why the brick and mortar and especially in Gwinnett County, we need something that can help these kids. We give scholarships at the place that I work, but it's like 30 days. And 30 days is just a drop in the bucket. It's not going to cure their addiction. They're never going to be cured of the addiction, but they can have the tools and they can have the process that they need to say no and to turn away and to find support groups so that they don't relapse. It used to be you can relapse, but you have some more chances. You don't have another chance now with all this stuff out there. My son relapsed, and he had a clean drug screen the night before. My husband and I drug screened him the night before. The 5-panel, the whole kit and caboodle. And he was clean. And he obviously had an urge, or we don't know what. It wasn't much from what we understand, and what little bit he did relapse from killed him. He didn't get another chance. I want to speak to the parents who have young kids that your kids are going to be approached to try something just once. It'll make you feel good. You can't even try it once anymore. You can't try it once and go, I didn't like the way that felt, I'm not going to do it again. You can't do that because they won't have another chance. The drug of yesterday is gone. It's now the drug of today, and you won't see tomorrow. So please get the word out. Please educate your families, your kids especially. And it's not so much just the kids, it's the grandparents. We all, both Kathy and I'll say it to you, we had our head in the sand. We had no clue that this was going to happen to our kids. So I just want you guys to be aware that, first of all you parents, grandparents, sons, daughters of mothers and fathers that have passed, don't blame yourselves. It's not your fault, it's the disease. And we've got to fight to find a way to cure it. Thank you.
Oftentimes when I've been working on this issue for the past 3 years now, there's been a misnomer that I run across repeatedly, and it's the fact that when you talk about drug overdoses, that people immediately think of children, they think of the 25-year-old male, but it's not that. When you look at the state statistics on overdoses, a lot of it is people my age. I'm 63 years old, it's baby boomers. And one of the things that we have here is from the medical community, Dr. Chris Hendry. And he fortunately drove up from Macon, Georgia, and we appreciate Dr. Hendry. He is the Chief Medical Officer at Navicent Health. Another thing that happens in the metro Atlanta area, we forget about South Georgia. We forget about rural Georgia. This hit the headlines in North Georgia and Metro Atlanta a couple of weeks ago, but then it kind of evaporates. So I think it's crucial that we remember that this is the whole state of Georgia. It's not just metropolitan Atlanta. Dr. Hendry, thank you for coming up and giving us a briefing.
Thank y'all for having me. As everybody's aware, this is an epidemic that's all across the nation. It affects all demographics. It doesn't just affect lower socioeconomic classes. It affects everyone. It doesn't just affect metropolitan areas. Several weeks ago in central Georgia, we had an outbreak of overdoses that it looks like the total will be somewhere near 30 overdoses with potentially 5 deaths associated with it. We had over 15 inside of Navicent in the emergency room. It came in within 48 hours and it can overwhelm the system. And luckily we had the supplies and the physician skill set to recognize what was going on. We got the drugs, the Narcan, into the patients, and we were able to save some. Not everybody. It's an overwhelming burden to the system when you have that kind of outbreak. It costs hundreds of thousands of dollars in expense to take care of some of the survivors that were on the ventilator for several days in the ICU. And the ongoing costs of managing their addiction once it's identified, and the devastation in the families that are affected by this disease. I would be remiss if I was not the first to admit that there is an opportunity to educate physicians better about how to handle the prescribing of narcotic medications. It's a gap in our medical education system. And the drugs that we learned how to manage are not the drugs that are on the street. These are other poisons that we weren't taught how to handle. And the potency of the opioids that we are able to prescribe now are much, much more stronger and potent than the medications we learned in training. So I think the CDC recommendations that came out about a year ago are an excellent step towards educating physicians on how to manage acute pain and chronic pain and the appropriate use of narcotic medications. And this is an ongoing effort to educate the physicians and the medical community on how to use these medications. As you heard before, some of them have good uses, but they have to be done under the appropriate supervision and in the right setting. Unfortunately, the cottage industry that's grown up out in the street developing these imitation knockoff tablets has taken root, and you're ending up having to now contend with not only people who, through no fault of their own, became addicted because of taking a prescription that was given to them. You also now have the opportunity where people are seeking these drugs out for the same euphoric effects that heroin produced. And so you have two populations that have to be addressed, and you now have two areas. The bill that's been passed, and which is excellent in managing how prescriptions are done and having physicians go back and see the list of medications that people are on before you prescribe anything is excellent, but we still need to not forget that now this is in the street, and law enforcement will have to figure a way to address that as well. Thank you for your time and allowing me to speak, and my heart goes out to you.
I was remiss to say that Dr. Hendry is the medical director at Navicent Health, and as most of y'all know, Navicent Health is located in Macon, Georgia. It is a level 1 trauma center. It is the only federally qualified trauma center in the state of Georgia. Grady Hospital is a level 1 also, but it's state qualified. So Navicent has done a great job with the epidemic, and unfortunately I think in the future they're going to continue to have to do more with it. The other person that I left out is Dr. Gaylord Lopez is here. He's from the Poison Control Center, which is located at Grady. It's a state-funded, partially state-funded poison control center. They do a Herculean task with their 1-800 number for all residents of the state of Georgia, and we appreciate what they've done in the past and what they'll do in the future. So with that, I believe we'll open it up for questions from the media, and then after that we'll go upstairs, and I know some of the media, I know everyone in here is about to wilt because I'm about to wilt, But if the media would go upstairs, that room is very cool. It's the conference room upstairs. And I think you'll have a better interview and the people will feel better. And you'll have access to all of these different families. So with that, does the media have any questions?
I just had a question of Joseph and Dustin's ages. Do you-
Okay.
Joseph was 19.
Dustin was 18,
Thank you.
Where did they live?
Lawrenceville.
What did they decide that the drug was, or what was it?
We don't know yet. The toxicology reports haven't come back.
Do you feel like fentanyl was part of whatever it was?
99.9% positive.
We do.
Yeah.
The amount that was found in the papers that they advertised on the media release was supposedly very, very,
Very
very
little.
small.
You know, one of the things, Sandra, that I think we're going to anticipate in the next session is additional money in the budget. As you recall, this past session, we had to add additional money for Vernon Keenan, for the GBI, for the morgue. And he came to me and said, Renee, you know, it's incredible. When I come to work, I look outside my window and I can see 20 hearses waiting for us to open up the morgue on Panthersville Road. And so we had to put additional money in the budget to increase capacity at the morgue. We're going to have to put additional money into the lab that Ms. Miles is so fluent. I mean, she's an expert in these analogs and the chemical compounds in these drugs. We're going to have to put more money in the budget. It's not fair to these parents for you to ask that question, what did your son die of? And they have to wait maybe 3 months, 6 months, and don't know what they died of. It's also good for intelligence in the law enforcement community to know exactly what's on the street and what people are dying from. Not saying, maybe they died from this one, maybe they died from this one, you know, we don't know. So I'm anticipating and hoping that we can put more money in the budget for that.
Senator, if you could discuss briefly the specific legislative initiatives you and others are going to
Yes.
take to battle this?
Yes, we are just in the throes of beginning to look and having study committees and looking, and I'm listening to the grassroots to see what we feel like needs to come forward. One of the things that I've heard about that I think is just unbelievable, I spent years and years and years working on child sex trafficking. This crime that I'm hearing about now is just as egregious as child sex trafficking, and it is the trafficking of addicted individuals, is brokering individuals. Individuals that come, they're headhunters, they may go to a shelter, like the Pine Street Shelter. Go down there and look for someone who has substance abuse. They hand them a ticket and say, would you like to get some treatment? Would you like to get off drugs? We will buy you a ticket on Delta Airlines and we will take you to a location where you can get treatment. And unfortunately, this has become pervasive. It's capitalization and victimization of addicted individuals. And to me, that is the worst crime. It needs to have a higher penalty. The state of Georgia, and I have the copy, the state of Florida had to write a law this year against brokering of patients, of addicted individuals. Now, how sad is that our society has sunk to that level? And I'm going to copy that law because it's very well written. And what happens, they go to states that have good reimbursement schemes, whether it's Florida or California, and they pick them up and they take them there and they get a headhunter's fee. That's the type of law. The other thing that I'm very interested in is the insurance reimbursement. And when you have an epidemic, people capitalize, corporations capitalize on it, and they can make more money. And it's the billing of services, because I've had lots of family members tell me that they're overbilled, they're overcharged. The insurance companies, now the family, this is private insurance. So we need to make sure that this unscrupulous type, if you would have told me 3 years ago I'd be writing a law about the brokering of addicted individuals, I'd say you're crazy. But I also didn't think I'd write a law about child sex trafficking. So the times have to change, but the most important thing, as Judge Schrader said, is additional money for brick and mortar therapeutic services. We got the cart before the horse with the accountability courts. It's wonderful, it's great. We have all these accountability courts like veterans courts, mental health courts, family courts, all these different courts, drug abuse courts. But when she sends someone to go get treatment and there's no place to go, how sad is that? I mean, 3 weeks after someone got out of, 2 weeks after they got out of jail, they died. because there's no services. And that's where I say that the appropriation process is more important than writing laws.
Are you talking about like the public health, like through the public health system, or are you talking about incentives for private brick and mortars to come and open up?
It would be through the Department of Behavioral Health, Developmental Disabilities, and Addiction Diseases, and it would probably be through the Community Service Board system, the current system, but we've got to develop best practices and standards of practice so that you don't have this nefarious type activity coming in. We wrote a bill with Senator Mullis about the methadone clinics in northwest Georgia because they were proliferating. I think it was Walker County had 7 methadone clinics and he's got 40,000 people. I'm in Gwinnett County, I got 1 million people and I got 2 methadone clinics. And they're profiteering off of those pickup truck and trailer and they got a methadone clinic. There's no standards. We have to develop standards.
Senator Renee, can you give us a sense of how many of these brick and mortar treatment centers you anticipate? Maybe the judge knows?
No, we don't know. We are working with the Department of Behavioral Health and the Department of Public Health in beefing up the system. And I have no idea. And we're in the process of OPB, the summer process of budgeting money right now. And hopefully it will be a new line item that will have additional money. We did receive $11.8 million of the federal grant. And, I told Judge Schrader, $11.8 million, I can use that much money in Gwinnett County on this issue. That's a drop in the bucket. And I know in Washington, D.C., I had a press release. I wrote a letter on Monday to Senator Isaacson and Senator Perdue saying, please, whatever you do with the Affordable Care Act, we need additional money for opioid and substance abuse programs, not just in the state of Georgia, but across the United States. And please include this in your negotiated process in the U.S. Congress and the Senate.
I'd like to respond to that too. I need everybody to understand that this is not going to be solved by government alone.
That's right.
It's going to take a community-wide effort. Volunteers, support. We're starting a program in Gwinnett County through my probation department with the day center. We got funding for a day center. My probation director is calling teachers on leave this summer to come and help our participants who most people in the criminal justice system drop out of school in 9th grade. They start using substances as early as 8. They don't know how to read. They don't have basic life skills. Those types of community effort to support people coming back into the system, learning life skills so that they can stay out of the system is key as well. So there's a lot of things going on. I don't want us to get caught up in the governmental process because that is going to take what I spoke about a minute ago, patience. But what we do need is a lot of community effort and not to rely just on the government.
Yes, ma'am.
What are you guys going to do about education in the school system? I have 8 children. The DARE program is no longer there. They're not educated. When he went back to school and they had asked why, he had said, I had lost my aunt to heroin. He was shunned and he was pushed down. They didn't want to hear about that. They're not allowed to talk about that. So education has to start in elementary and go up. That's when you're going to get that.
I've met with our school board in Gwinnett County, and we're having meetings on a regular basis about how to build in curriculum into an already packed skill. That's another way. Parents, reach out to your school system. Teachers, reach out to your school community. Y'all are a tight network and you can make things happen. So reach out and make sure to demand curriculum in the school.
I wanted to tell my sister's story. And they said, I'm sorry, we can't do that. But these kids can go home and play Grand Theft Auto and kill people and race cars, but you can't give them the truth about addiction and how it's killing everybody.
I know one of the things that we're working on in this collaborative effort, and I in particular am focusing on the northern counties of metropolitan Atlanta, is looking at which counties are doing a better job and which ones aren't, and we're copying and mimicking. And one county that seems to be light years ahead is Cobb County.
No, they're not. We're in Cobb County.
Let me finish. They are doing better steps towards education versus other counties that are doing nothing. And one of the things that they do that I'm trying to copy in Gwinnett County is at the beginning of the school year, when parents are really interested in the school and the kids and everything, they send out a magazine, and it's about substance abuse. And if a few years ago you would have told me that they did that, I wouldn't have believed it. But they're taking baby steps. I agree with you. There's not enough done, and we
Well,
want
if
more
they're
done.
sending these magazines out, I have not received one.
Can I make a comment? Florida and Pennsylvania both have chapters called NOPE, N-O-P-E. If you Google it, you can get on their website. I've already started the process to get a chapter started in Gwinnett County. And it's where you've got all of you parents or grandparents, whoever you are that lost a loved one to addiction, you can get yourself in front of the school system, churches, youth groups, those kind of things, which is what my goal is going to be doing, and actually have a picture of your loved one and tell your story in front of the parents and the students and the teachers, the administrators, all of them in a school system, and they'll back you 100%. So I urge you in every county that you're in, Google the word NOPE, it's all caps, and I can't remember off the hand what it stands for, but they will start chapters in your, we don't have one in Georgia, only Pennsylvania and Florida.
Okay. I know we have to end the news conference. I think there's one more question.
Senator, can you talk about what you'd like to see in the Senate health plan and just address some of your concerns that you did express in your letter?
Are you talking about the congressional?
Correct.
Yes. I wrote the letter, and you should have a copy of that letter that I wrote to Purdue and Isaacson. And what I want with the Senate plan is for that plan to continue to move. I'm concerned that it's stalled now. I am glad that they're negotiating, and I go through that process too. It's the carrot and the stick. If I give you this, will you vote for that? But the most important thing I want to remain in it and to see an increased amount of money is for substance abuse, and specifically for the states to be able to fight the opioid epidemic and that drawdown. And so we can match state money with federal money, and that's a completely separate topic than the Medicaid. The thing that concerns me about Medicaid and cutting the Medicaid budget is that it then becomes uncompensated care. It becomes 100% state dollars. So if you cut the Medicaid budget and you say, states, you're going to have to eliminate this number of people, those people are still going to go to the emergency departments. The bottom line is we have hospitals closing in the state of Georgia. We want to discontinue the hemorrhaging of those hospitals to maintain our existing infrastructure. And I'm not sure we're going to be able to do it with potential cuts to Medicaid. And the other thing I think, and I'll get off my soapbox about Medicaid, is we are a non-expansion state. I think we should be rewarded because we are one of the lowest per capita Medicaid reimbursement rates in the nation. I think we should be congratulated. We've saved a lot of federal money. And instead of punishing us and taking away money from us, we should be rewarded. And I believe that's what the governor said day before yesterday when he was interviewed. No, we have to go upstairs. So with that, is there any other questions from, I'm sorry.
That's okay.
Everybody's so hot. Is there any other questions from the media? Because are y'all interested in going upstairs and meeting with the families? You are? Okay, so can you direct them how to go?
Yes, okay, so if media can just kind of hang on because you have the cameras and stuff, please, for just a moment, but all the families, parents, anybody, there's an elevator right here, and there's one through the double doors. Go to the third floor and go to the right. There's actually signs on the